The sick just keep on coming.
Contessa, the World Health Organization has declared the coronavirus outbreak a public health emergency of international concern.
The number of cases has spiked over the past week, and the city of Wuhan continues to be at the center of the outbreak.
Hi guys, welcome back to the channel. If you're new here, my name is Nosa. I'm a medical doctor in the UK, and I make videos on medicine and lifestyle. So today I'm going to be talking about coronavirus. Now, if you haven't heard about coronavirus, I mean, you're probably living under a rock because it's been everywhere on the media. And basically, on the 9th of January this year, China reported to the World Health Organization that they had discovered this new virus in patient samples taking over there. And that was quite scary because it has already caused quite a few deaths. But the question really is, how worried should we be about this virus? Is it as bad as SARS? Do you guys remember SARS in 2002? Or MERS, which even had a higher mortality rate? We'll be talking about those things in this video, how to reduce your chances of getting this virus or any other virus in general. I'll also be covering where we think this virus came from, how we think it's being spread, and basically everything we know about this virus so far. If you didn't know already, coronavirus is actually pretty common. It causes the common cold, for example. It also causes this chest infection, quite common in children, known as bronchiolitis, and it can cause more severe infections like SARS. So the question is, if coronavirus is already so common, why are we so bothered about it now? And it's because this virus that has just been discovered is the first subtype, or rather strain, of coronavirus we know, and it's causing quite distressing symptoms and has caused quite a few deaths already. With regards to where this virus came from, nobody is completely sure. We think it's most likely come from an animal that has transmitted it to a human. I've heard, a few people say it's come from like a bat or whatever, but there's actually no confirmation of this now. The suspicion is that it's come from an animal, but we cannot say for sure which animal this is. There are 4 main symptoms when it comes to identifying coronavirus: a fever, so a high temperature, shortness of breath, chest tightness, and coughing. Now, those are 4 symptoms that coronavirus presents with. But what's even more confusing is the fact that so many other conditions present the same way. So just because you've got those symptoms does not mean you've got coronavirus. To be honest, the only people that should be concerned about having coronavirus with those kind of symptoms are those people that have been to Wuhan City in China, or those that have come across someone that has been to Wuhan City in China. Coronavirus, people are probably carrying it around China and don't even realize because they've just got mild symptoms. So it's not always going to be something severe. Now, the people that have died from coronaviruses are those people that have gotten severe infections from it, like pneumonia. And pneumonia is really common around the world and causes quite a few deaths, especially in the people that, are diabetic, so they've got weakened immune systems, HIV patients, or just elderly people. When your body is just not as strong as it used to be to fight infections, you're more susceptible to quite severe infections. In terms of how we think the virus is being spread, we think there's human-to-human transmission going on, and we think you get it through indirect or direct contact with respiratory droplets of an infected person. So for example, when I say indirect contact, I mean if they sneeze on a surface, somebody with coronavirus sneezes on a surface, and then you take your hands, go and put your hands on the surface, you don't wash your hands, and then you touch like a mucous membrane to your nose or something. You can get coronavirus that way, or you can get it directly from someone sneezing onto you, and that is how we think it's being spread. But there's nothing really unusual about the way it's being spread, because for example, the flu virus known as influenza also gets spread that way, and a lot of other cold or chest infections get spread that way. One thing that we don't know yet about this virus is actually the incubation period, and we like to know the incubation period of diseases because it allows us kind of know, okay, so how long between when this person gets infected and do they show symptoms? Do we need to keep them segregated from people if we need to? One of the main issues with this new coronavirus that we found out about is that we actually don't know how long people have been carrying these viruses before they present with symptoms. And when you're carrying this virus and you don't have symptoms, you're just going to be going out, meeting other people because you don't realize that you've got the virus. And that is one thing about it is that it can spread very quickly for that reason. If you have a virus with a short incubation period, so let's say the minute you get to 2 days after you're presenting with symptoms, you're not likely to spread it very much because okay, I don't want to give this to other people, let me stay at home. But with coronavirus, we think you can be without symptoms for up to 14 days, which is a bit concerning for the reasons I mentioned earlier. If you're based in the UK like me, the good news is there are no confirmed cases of the coronavirus here yet. However, I must say that there is quite a high chance that the virus is here already, but it's not causing any severe symptoms, so hence why it might not have been identified. So let's get into just how many deaths coronavirus has caused and how many people have been infected. I've got the numbers here. So far, as of when I'm filming this video, there have been 5,974 confirmed cases of coronavirus worldwide, and 132 people have died. Now, that means there's roughly a mortality rate of about 2%, which is actually not too bad. As of now, Public Health England is referring to this virus and considering it low risk, which is a good thing, based on these numbers as well. When you compare it to SARS, which emerged in 2002, I'm pretty sure a lot of you have heard about SARS as well. That also emerged in China, and 774 deaths were confirmed worldwide. Basically, 1 in 10 people infected died. That is quite high in comparison to coronavirus so far. MERS, on the other hand, which originated in Saudi Arabia in 2012, killed 1 in 3 people affected, almost a 30% mortality rate. That is quite high, and that is the most serious virus out of those 3 I mentioned. Influenza virus, which is the virus that causes the flu, which everyone hears about, and we kind of throw the word around here and there, I've got the flu. It actually causes 650,000 deaths a year worldwide. So what I said before and what I'm saying again is that these viruses in general, we have them worldwide and we've been coping with it so far. They cause deaths in people that tend to be immunocompromised, so people with weakened immune systems. And this coronavirus is not presenting in any way that's unusual to the viruses we know already. Unfortunately, there's no treatment for coronavirus at present, but that is also the case with other viruses like the flu virus, influenza. And usually when people go into hospital, but the treatment is supportive, which means that we're just trying to help your body be in the best position it can to fight off this infection. So for example, if your blood pressure dropped or you got dehydrated, then we would give you some fluids through your veins. If you suddenly were not able to breathe, we might ventilate you. So basically put some equipment in to help you breathe. And if your temperature were to go really high, we would give you some paracetamol to help bring that temperature down, to put your body in the best position it can be to fight off this infection. But as far as giving you something to actually kill the virus, unfortunately, there's no medication for that. Now, word on the street is that vaccines are currently in the works for coronavirus, which is good. So people that get vaccinated, if and when that vaccine comes to the market, would be at a much lower chance of getting the virus. As with the influenza virus in the UK, we tend to give that to people in vulnerable positions. So we tend to give those vaccines to people that work in healthcare, so they're coming in contact with a lot of people with viruses like that, or people with weak immune systems and the elderly. And I suspect that's probably what's going to happen with the coronavirus as well, if it does come out, is that it would be mainly for the immunocompromised people. So let's talk about how to prevent your chances, or rather, how to reduce your chances of getting coronavirus, because nothing is 100% foolproof, Number 1, obviously stay out of Wuhan City, China at the moment, okay? You don't need to be there right now. And number 2, wash your hands. Now, the most important thing with preventing this virus is actually good personal hygiene, because if you go and touch a surface that someone with coronavirus has happened to sneeze on, and you go and touch your nose or whatever, your mucous membranes, then you are likely to get the virus. But if you wash your hands, quite regularly, then you're unlikely to get that virus. So good personal hygiene is the most important. Good hand hygiene especially is the most important thing. I've seen quite a few people wearing this mask, and the question really is, are those masks beneficial? Truth is, I mean, no one's really sure. What I do know is that in intensive care and in the hospitals where people are kind of, should I say, barricaded to prevent the spread of this infection, people are wearing similar masks. But when you see people on the road with these masks, the suspicion is that they're not actually using these masks properly, and they're not the same type that you get while you're working in the hospital. So, I mean, there's no actual proven benefit from wearing the mask, but I don't think there's any harm either. Oh, and by the way, if you don't have the opportunity to wash your hands all the time, at least get some alcohol gel. Man, I always have that. Like, my hands always kind of taste better because I'm always putting gel on it when I'm not able to wash. To prevent spread of infection, there's this saying, catch it, bin it, kill it. So basically, if you want to sneeze or anyone wants to sneeze, they should take a tissue, cover their nose, go, that was a terrible attempt. And then, put the tissue away and throw it away. That is the best way to prevent spread of infection. But I get that people don't always have tissue, okay? Now, if you think you've got this virus for whatever reason, which is unlikely, by the way, then you should stay at home for sure. Just stay at home. And then call 111 if you're in the UK to get some medical advice, and they will tell you exactly what to do. Okay, don't go out, because you could be spreading it to other people just in case you've got it. And it's kind of the same advice we give people with the flu as well. If you've got the flu, try and stay at home. Don't go and start giving it to all these elderly people that might not be strong enough to fight off the infections, or people that are immunocompromised. So that is the main thing. The main thing with all these viruses and coronavirus is that the most vulnerable people are those with weakened immune systems. Now, for the most up-to-date details on what's happening with this virus, how many cases there have been, or how many people have been infected, I'm going to link details down below of the website. You should go and get the most accurate information. You don't need to be reading these newspapers because they panic, they make people scared, and that fear makes people click on their, crazy titles and stuff. So just stay well informed and go to reputable websites for the information about this virus. As of when I'm making this video, all the information I'm giving you is correct, but things can change quite rapidly, so make sure you're staying up to date yourself. If you enjoyed this video, please give this video a thumbs up. Thank you guys for watching, and I'll see you in my next one. Oh, and if you haven't already, subscribe to my channel, guys.